Common symptoms of uterine fibroids. Uterine fibroids are the most common and frequent benign tumors in women. The incidence rate among women of childbearing age is as high as 50 to 60%. Its occurrence is mainly related to the strong hormones in the body. We should face it with a calm mind. Not all uterine fibroids require treatment. Through our understanding of the common symptoms of uterine fibroids, you can initially determine whether you have uterine fibroids. Of course, the final diagnosis can be confirmed by B-ultrasound or MRI. Uterine fibroids are often accompanied by the following common symptoms. 1. Abnormal menstruation. Manifested as the shortening of the menstrual cycle. Once every 20 days, the menstrual period is long, and the number of bleeding increases. 2. Abdominal lumps. Uterine fibroids less than 3 months of pregnancy are generally not easy to touch the mass through the abdomen. The one that can be reached is generally in the middle of the lower abdomen, which is hard and uneven. In patients with a thin abdominal wall, the outline of the tumor can be clearly felt, and even its appearance can be seen. When the mass is large or grows too fast, patients with uterine fibroids can often feel the mass in the middle of the lower abdomen, and the texture is hard, especially when the bladder is full in the morning, which may be accompanied by a feeling of falling. An abdominal mass is often the main complaint of patients with uterine fibroids, which can be as high as 69.6%. Sometimes it may be the only symptom of fibroids. Uterine fibroids are generally located in the middle of the lower abdomen, and a few may be on the lower abdomen side, with hard texture or a sense of unevenness. Most fibroids do not grow fast. A very small number of fibroids may grow faster, or accompanied by a dull pain, and treatment should be considered at this time. 3. Anemia. Uterine bleeding is the main symptom of uterine fibroids and occurs in half or more of patients. Anemia may occur in patients with uterine fibroids who have long-term bleeding without timely treatment. When fibroids make the uterine cavity larger, the endometrial area increases. Uterine contractions or endometrial hyperplasia, or submucosal fibroids, can be manifested as menstrual prolongation, menorrhagia, or irregular vaginal bleeding. Among them, cyclic bleeding is the majority, accounting for about 2/3, while non-cyclic bleeding accounts for 1/3. 4. A sense of oppression. Compression symptoms mostly occur when fibroids compress surrounding organs. Lower extremity edema may occur when pelvic veins are compressed. Compress pelvic tissues and nerves, causing lower abdominal pain and back pain. Compress the bladder, urethra or rectum, causing frequent urination, dysuria, urinary retention or constipation. When the ureter is compressed, it can cause ureter or nephropathy. Compressing pelvic blood vessels and lymphatic vessels can cause edema of the lower extremities. 5. Pain. Uterine fibroids are manifested by abdominal pain in 40%, backache in 25%, and dysmenorrhea in 45%. There are also symptoms of lower abdomen swelling or back pain, and the degree is not very serious. 6. Increased vaginal discharge. Increased leukorrhea in patients with uterine fibroids accounted for 41.9%. Intramural fibroids increase the area of the uterine cavity, increase the secretion of endometrial glands, and are accompanied by pelvic congestion, resulting in increased leukorrhea. When submucosal fibroids have ulcers, infections, bleeding, or necrosis, bloody leukorrhea or purulent leukorrhea is produced, and the amount can be large. 7. Abnormal urination and defecation. Fibroids are large or grow on the cervix, broad ligament, etc., and clinical symptoms of squeezing adjacent organs in the pelvic cavity may appear, such as constipation, frequent urination, increased residual urine, ureter shift, hydronephrosis, etc. 8. High blood pressure. Some patients with uterine fibroids are accompanied by hypertension. Analysis and statistics of fibroids with hypertension, except those with a history of hypertension, return to normal after the fibroids are removed, which may be related to the relief of ureteral compression.